Your station for health, and when getting medical advice, it's important to get a second or sometimes third opinion. Here to tell us about an option that connects people with board-certified doctors from the comfort of their own home is Jason Melton, the CEO of 2nd.MD. Good morning to you.
Good morning, Denise.
So this obviously very convenient. When and how did this get started?
2nd.MD was founded in 2011, and our founder, Clint Phillips, his daughter had a stroke after birth and was paralyzed on the right side of her body, including her face. First doctor said that she couldn't help. The next doctor was several hours away, said your daughter will never walk or talk. Clint tried his best to find the right doctors that could help his daughter. It took several months. He finally found an appointment with a doctor here in Houston, 4-month waiting list. That doctor said, I can't help you, but recommended somebody else. And he just had his life passion. He knew that there was technology and medicine today, there's a better way to get answers for people.
Yeah, and you know, some people may feel it's not always necessary, though, to get a second opinion, but tell us about all the benefits in doing so.
Unfortunately, it's very difficult for doctors to stay up to date on the latest medical advancements. In fact, studies show that the average doctor is 17 years behind the latest medical research. What we see with 2nd.MD consults is 82% of the consults that we do result in an improved treatment plan. 24% of the people aren't even diagnosed accurately on their way into a 2nd.MD consult. And 29% of the people who've been told that they need to have surgery, once they speak to an independent expert, they realize there's a better way and wind up canceling their surgery.
Wow, and so how does this service work? Kind of walk us through it.
Sure, I'll give you a quick example from my own life. About a year and a half ago, I nearly died in a ski accident. I went over the edge of a run in Snowmass near Aspen, and I did a head plant in a hard-packed catwalk 15 feet below. I shattered my helmet and my wrist, but I broke my spine at the base of the skull. And what I did was called a hangman's fracture. It's usually fatal. They life-flighted me to Denver. The neurosurgeon came in and he said, your head's not connected to your body by your spine anymore. We have to fuse your neck, or you could die. And so we had a 2nd.MD consult, and an independent expert explained to me that if I did what the doctor in Denver said, I would lose half of my head rotation for the rest of my life. And there was a better way. They could go in through the front with a single screw and I'd have a full recovery. And I was able to do that from my hospital bed just through our mobile app and see all my imaging and the diagrams. And so I had the alternative surgery. I now can do everything I could do before. I was skiing 9 months later. And it's just a wonderful benefit for our family.
That is incredible. So how do you link the patients with the doctors?
Yes, so we have a very specialized team of nurses that will hold your hand throughout the process to understand what's going on with you, what's been recommended, what tests you have. We go get all your medical records, and then we are pairing you with an elite expert targeted for your condition, your specific niche of whatever the specialty or subspecialty is that you need to see. We have the right expert across the country, and with the technology, they don't have to be in your neighborhood. They can be literally on a different coast. You could be in the comfort of your home and get the expert advice you need.
Wow, that is so great. Always good to have another option.
Yes, thank you.
All right, thank you so much.